In the second part of my video series on fraud, I'll address the public findings of fraud in the Child Care Assistance Program known as CCAP. Now, the federal program was created to help families pay for childcare so that parents can work, they can go to school, or they can just look for work. In 2018, $217 million was spent, taken from all taxpayers, to pay for childcare for 15,000 Minnesota families. This averages more than $17,700 per family. Now, CCAP, it's supervised by the Minnesota Department of Human Services, or DHS, and they develop policy and they oversee the implementation of this program. Families have to apply for CCAP benefits at the county, but once they're approved, they just choose a child care provider who accepts CCAP. There's 2,600 child care centers and 600 family child care providers who accept CCAP in Minnesota. The centers submit the bills to the counties, but the checks are actually cut by DHS. So payments are made directly to the child care providers for eligible children. They even reimburse for holidays and if the kids are absent. But providers are eligible for 20% higher rates if they have credentials from, let's say, the four-star parent-aware rating system. Now, let's look at the oversight. The Office of the Legislative Auditor was commissioned by the legislature to report on CCAP fraud in the oversight. And these reports were finally made public in the last month. We have a serious problem with fraud in this program. Jay Swanson, the manager of DHS, he's the recipient and child care provider investigation unit. He wrote this earth-shattering report of his 4 years investigating child care fraud. One example he gave was that 15 centers were found to be fraudulently billing CCAP and the payments were stopped. But these centers had overbilled 12,667 children. Now, those 15 centers alone had been paid a combined total of over $56 million. Now, investigators, they have concerns over about 100 of the top 150 centers. Just the top 100 centers were paid over $118 million, or 54% of all CCAP dollars. He then details how fraudulent centers are opening in the same location as previously fraudulent centers. Centers are being opened for no other reason than to defraud CCAP, and they have clear evidence that owners of the centers are engaged in money laundering on a large scale with all the proceeds from the CCAP fraud. Now, part of the design flaw of the system is that parents and providers are working together to defraud taxpayers. Centers are paying parents kickbacks in the fraud scheme. Now, the parent-aware rating program has also become susceptible to fraud, since providers with a 4-star rating receive a 20% higher than normal payment. They can obtain these higher ratings, and according to investigators, 40% of the cases that they investigated involved large-scale billing fraud committed by a provider with the highest rating, quality rating. In the second report released this month, the OLA had 5 findings. The first one was that DHS is not checking to see if people even qualify. They're not looking at the data available to them today to verify income, residency, or employment. Now, the second finding is that they're not verifying the CCAP billings even aligned with the actual child care provider. So there's no ability to verify the child care centers are actually providing child care to these children. Now, the third finding has to do with the system that they use for billing. And they're not using the system correctly to track errors and throw red flags and to try to recover improper payments for the centers. So in other words, they weren't using their system properly. And the fourth finding is that DHS didn't implement sufficient program integrity controls for licensing child care providers. See, the licensors, they didn't even visit the physical child care center to see if they even existed. Now, the fifth finding was that DHS did not adequately identify and analyze the risk of fraud in this program, and they had weak processes and oversight to coordinate all of their investigators statewide. So in 2014, the Child Care Center and Development Block Grant Act passed Congress, and it requires the states to perform some extra oversight in the CCAP program as a result of seeing fraud nationwide. And one requirement is that DHS has to have one unannounced visit to each child care center at least once per year. That seems reasonable since we're paying these centers hundreds of millions of dollars. But the state failed to meet this requirement in 2016, in 2017, in 2018, and we haven't seen it yet this year. It has 33 licensors, the people responsible for these visits. Now, there's 1,800 centers plus 600 government ones. That means each licensor would have to visit 72 centers a week, 72 centers per year. And that would mean just like 6 per month. So these are unannounced visits. There's no need to schedule anything. The counties are responsible for administering the payments to recipients, but DHS cuts the checks. So if a child care center isn't compliant with all their paperwork, you'd think they wouldn't get paid, right? But that's not exactly true. Counties can manually override these errors and shortcomings for non-compliant centers. And they can do this so long as it's less than 25% of all the centers in their county. If they happen to override more than 25% of the centers in their county, then DHS actually gets a report. So let's just give you an example. If there's 400 centers in Hennepin County and 100 of them are not compliant, the county worker can still override payments to 100 of them, and then DHS wouldn't be aware of that. And if they happen to override more than 25%, the only thing that happens is DHS gets a report, and the county must choose one center which was overridden and submit the reason why that one center's payment was processed using an override. So there just is no oversight. When the OLA asked DHS for a list of centers being investigated, they expected to see a report generated from their system of when it was reported and all the data, but they found that there's no system that they use for tracking fraud cases. There's not even a spreadsheet. The CCAP program is ripe with fraud, and the investigators estimate that over $100 million of fraud per year is being taken from taxpayers. That means that the program, just since the federal government required stricter controls, has defrauded us of over $500 million. A program which is estimated to be at 50% fraud just cannot continue. It can't continue. The state has no right to ask for more money from taxpayers when they're ignoring rampant fraud, waste, and abuse of taxpayer dollars today.